Today marks World Hepatitis Day to enhance awareness of viral hepatitis and inflammation of the liver that causes a range of health problems, including liver cancer. The World Health Organization says that the condition claims the lives of nearly 900,000 people each year. It says that the proportion of children under 5 years of age chronically infected with hepatitis B dropped to just under 1% last year, and that's from 5% in the pre-vaccine era, which is a period between the 1980s and the early 2000s. The Global Health Body says that this marks the achievement of one of the milestone targets to eliminate viral hepatitis in Sustainable Development Goals. To tell us a little bit more about this condition, I'm now joined by Dr. Andrew Scheibe, who's a technical advisor at the TB HIV Care and researcher at the University of Pretoria. Thanks so much indeed for joining us, Dr. Scheibe. Welcome to the program.
Great, thank you.
There's so much to talk about in terms of hepatitis, and I think there's a lot of ignorance around it because some people think it's an STD. So let's start there. What is hepatitis, and is it an STD?
So viral hepatitis can be, some of them, viruses can be transmitted through sexual contact, particularly hepatitis B, but it's most commonly spread through blood, the hepatitis B and C. There are other hepatitis viruses like A and E that are spread through fecal-oral routes. But usually the most important ones in terms of deaths and disability are hepatitis B for Bravo and C for Charlie. And they are transmitted largely through blood products, and hepatitis B also through other bodily fluids.
And I was also reading there's something else called alcoholic hepatitis.
Yes, so all hepatitis means is inflammation of the liver.
Okay.
And it can be caused by a range of things. And World Hepatitis Day, as a public health focus, is on viral hepatitis in particular.
All right. So one of the big issues, and the theme sort of suggests that there are missing millions, is that people who are walking around with hepatitis and don't know.
Yes, because it's one of those infections that you can have, and it develops a chronic infection in your body, so it can last for more than 6 months. And it's only after 10, 20 years before you start developing symptoms. And by the time you start actually feeling that there's something wrong, there's quite a lot of damage that's done to your liver in particular, but also other bodily functions get affected. So usually people are asymptomatic, so which means they don't have symptoms. And that's why it's important for people to test for viral hepatitis. Similarly with HIV, as many people can have HIV for many years before they actually start having symptoms, or the immune system gets to a stage where they have opportunistic infections, and that's when they think to test for HIV.
So typically, what kind of symptoms present that you might start to think, listen, I better go get tested? What kind of symptoms are we talking about for these viral hepatitis that you're concerned about?
So for any hepatitis, which is inflammation of the liver, because there's damage to the liver, sometimes there can be some general illness, flu-like symptoms. People can have pain over the liver area. And the most common sign is that's what someone looks like is when people get jaundiced, which is that yellow coloring of the white of the eye and also of the skin. And people can also have discoloration of their urine and of their stool. When people are adults and they get those acute symptoms, it's often hepatitis A or hepatitis E. But with hepatitis B, you'll see the symptoms are often as the complication of hepatitis. So sometimes people might have problems with blood clotting, sometimes problems with developing changes in the way that their blood flows through the liver, which is called portal hypertension, and people can sometimes bleed through what are called varices in the throat when people kind of have vomit blood. Those are the long-term consequences of having hepatitis. But sometimes people can just feel generally unwell, like a chronic sense of fatigue, and that can in times be in hepatitis. And it's particularly important if people are at high risk. So as you mentioned earlier, viral hepatitis B is vaccine preventable. And since the mid-90s, it's been part of South Africa's childhood immunization program. but people before then wouldn't have been vaccinated. And also there's certain people who are at high risk of contracting hepatitis B, particularly those people who are health workers or people exposed to blood, including people who inject drugs as well without access to appropriate prevention interventions.
All
So
right.
it's one of those things that...
So drug users perhaps not using clean needles, particularly vulnerable to this kind of viral infection?
Yeah, that's the main, among adults, it's people who inject drugs who are particularly at risk for hepatitis B. So in South Africa, we did a study where about 1 in every 2 people who inject drugs is infected with hepatitis C. And the main reason is just not having access to sterile injecting equipment. So if people have access to sterile injecting equipment, there's no chance of contracting the infection. And it's also, if people are vaccinated and aware of the condition, they're able to prevent it.
All right, so what's the most important message you'd like to get across today? People watching have heard about hepatitis but don't really know what it is. What ought they be doing? What ought they be thinking about?
I think if you're an adult, it's important. If you were born and you're in South Africa and it's after you were born before 1995, you should have a viral hepatitis B test to see if you are infected or not. I think if you're a parent or you are a child carer, it's important that you ensure that your children get vaccinated, particularly in the time of COVID and places where people are trying to avoid health services. But vaccination is really critical. And so being able to vaccinate people against hepatitis B is really, really an important thing. I think also to note that people use drugs for a range of reasons, and harm reduction is evidence-based, it works, and just supporting these services where they exist and referring people who might be injecting drugs where they can access and also return used injecting equipment is really important.
All right, so we've got a vaccine for hepatitis B, I think you said. The other
Yes.
strains, there's no cure.
So hepatitis B we can't cure, but we can manage very well. Usually if people are infected, like with HIV, they require treatment for life. Hepatitis C, there's been a revolution in medical science where it was a medical condition that caused cirrhosis, which is scarring the liver and liver cancer. And the previous treatments were very expensive, were poorly tolerated and didn't work very well. And a couple of years ago, a new medication called direct-acting antivirals were invented, and they cure about 95% of our hepatitis C cases. It was initially very, very expensive, but over time, the prices have reduced significantly, and it's affordable in many countries. The challenge we have in South Africa is the treatment for hepatitis C is not yet registered, even though the dossiers and the application process has been submitted several years ago. So it's a bureaucratic process. So essentially, it's quite difficult to get hepatitis C treatment in the public sector, but also in the private sector. And it's a critical health condition that we need to be able to treat.
All right, Dr. Scheibe, thanks very much indeed. And this is a subject I think we probably need to visit a lot more than just on World Hepatitis Day. So I am going to undertake that we chat again soon and just keep this conversation going. But thanks very much indeed for joining us tonight.
Thanks.
All right, that's Dr. Andrew Scheibe talking to us about hepatitis. Today's World Hepatitis Day. He's a technical advisor at the TB HIV Care, and he's also research at the University of Pretoria. So if you were born before 1995, you want to go get checked out because there was no vaccine available at that time. But I think generally for your health, particularly in an era of COVID-19, the warning is go and get tested for hepatitis. It is manageable and preventable if you can get a vaccine.